I believe I was infected about 6 years ago. I had a Bartonella rash. Well, I now know to be a Bartonella rash show up, and it got passed off as stretch marks initially by the primary care doctor that we were seeing. After that, it kind of just showed up in little ways of memory issues, joint pain, depression started setting in, and lots of brain fog. I was in eighth grade at the time, so I had a lot of trouble learning and kind of processing things. And I was under the impression that was just a standard teenage experience, uh, that you were just supposed to get a little more confused and start hurting more. But eventually got to a point that this can't be the standard experience. So
And that's hard as an eighth grader, knowing you're having pain, you're having brain problems, but also you don't know what normal is as an eighth
mhm,
grader. Yeah.
yeah.
Okay. So started to notice there was some problems. And then, fast forward, how did that play out over time?
Well, it kind of was something that again pushed off for quite a while. A couple times we'd look into different issues and go to the primary care and say, hey, I was having some blood sugar issues for a little while. I was powerlifting a lot, and I was having a hard time like staying awake because I was feeling tired and exhausted and those sorts of things. And I got written off as either blood sugar issues. At one point, my doctor did want to put me on like depression, anxiety medication, that sort of thing. And eventually, we're over the course of a few years, kept putting pieces together. I had the fortunate blessing that my mom had also had Lyme. Not fortunate for her, but she had seen kind of some of those pieces. And over the course of it manifesting itself, we were able to kind of start to put those pieces together and say, hey, I think we need to start asking these questions about Lyme disease beyond the panel that the primary care doctor was running.
Yeah, if I remember right, you found another Lyme doctor before me.
Yeah, right about. It had been about 4 years. I went to go see the doctor that my mother had actually
Hmm.
had and had helped her. Unfortunately, about 6 months into treatment with him, 3 months, something like that, he passed away. He was a Lyme literate doctor and everything, and
Hmm.
so that kind of threw a wrench in things. And we decided, well, we're going to take the information that we do have from him and try to kind of treat from there. But he was doing a combination of prescription and more naturopathic options, and so that made it difficult to continue because I can't write my own prescriptions, and I just didn't have the knowledge or honestly energy to continue doing that. So after about a year and a half, where we were like, okay, we're not fixing this thing at home, we started searching again. That's when we came across you and your practice.
Yeah, and we met a little less than a year ago, right? We kind of
Yeah,
met, and then we started, um, ran some tests, right? And found you still had some tick-borne things, right? So the doctor had made some progress, we kind of thought, but just you'd had to quit, because of extenuating circumstances before it was all complete.
yeah.
So how are you feeling by the time we met, which would have been, January of this past year? What were you feeling like? How was it affecting your life? I mean, bring us up to the kind of current picture right before we met.
Sure. Ever since my freshman year of high school, I've always been working a job of some sort during the school year. I wasn't in sports, but I did a lot of weightlifting, that sort of thing. So I was active and my body worked. Um, then by the time that it came around to coming to you, I was in my first season where I wasn't holding a job, because I just didn't feel like I could continue with it. I was just tired endlessly. There was no amount of sleep that I could get that was enough to make me feel rested. Depression had set in pretty heavily and put in some dark places, and it was I didn't feel like myself, and people around me were starting to notice as well that like this is not a happy person anymore. And I mean, I couldn't go for a walk without my knees and feet and hips hurting. I couldn't pick up weight at the gym without my shoulders hurting and feeling. I would quit because my joints give out before my muscles could give out. Um, it was just a lot. And had I not had somebody to push me to find somebody else, I probably would have just given up. Like
Mm.
I was beaten down at that point.
I mean, so 20 years old and obviously so much pain that a 20-year-old should not have, right? And this is,
Hmm.
what we tell people a lot of times it looks like a rheumatology thing to have a young man with that much pain, but really it's Lyme and it's coupled with these neurological problems. So you kind of have the fatigue, the nerve problems, and the joint problems. You kind of have all three hitting you pretty hard, even as a very young, typically a very robust age, right? So run us through how you're doing now and maybe a little bit of the time frame if you can recall it.
Sure. Initially, after our first in-person appointment, to kind of consult and set up, we started immediately on some supplements that I believe were killers, feeling it out a little bit, seeing how things would respond. I want to say we ordered a test fairly quickly as well, to get some
Hmm.
good numbers and to quantify what we were looking at.
Yep.
And
Yeah, we did. Yeah, we did.
yep. And so the initial timeline that you would give me was, about 3 months, you'll start to see some progress, hopefully. And then we were looking at, I, I believe we said anywhere from 9 months to year and a half, something like that, before we saw significant progress. I was very fortunate that I'm 6 months, maybe 7 or 8 months now into treatment, and I'm in a different place entirely. Like I'm happy and I am able to get around and do things. I can work a full day and not feel exhausted. Um, we are kind of I'm not all the way in the clear yet as we're kind of entering the rebuild period and getting a lot of the mental symptoms figured out and that sort of thing. But I appreciated having that explanation along the way as well, that step by step of here's what we're going to do. We're going to kill it. Now we're going to support your body, and that kind of that back and forth.
Yeah. Yeah, I think that's the analogy I use. If you have a knife in your leg, you got to pull the knife out. That's very important, but you still have the hole in your leg. And so it's not just about, killing Lyme. It's about helping your body heal and become strong again afterwards. But yeah, I remember we talked at our last appointment and you were just excited because life, just the practicality of life, it looks so different than the way it did this time, last year. If we look back to how you were last Christmas before I had met you at that point, and you were just saying, man, last Christmas was, it was different.
Hmm.
Yeah.
Yeah, yeah. It was just and my I recently moved away from my parents and I've moved into a place of my own, so I haven't seen them as much. But when my mom, who's been the majority of the person to walk this journey with me, um, even she's saying over the phone that she's like, "You just sound different," and she's like, "I got my son back," and
Oh.
that was a emotional but happy thing to hear.
It's very nice and it's exciting. These are fun times for me when I get to talk with patients and they're telling me about all the things they're doing and because you're feeling better. So hey, I'm doing this job and hey, I'm moving out and hey, I'm doing these things and those are big wins that maybe didn't even seem possible a year ago at this time.
Yeah, it it's crazy. I'm struggling for words because it's hard to explain how doing everyday things doesn't feel possible, and now it does. Prior that it didn't feel
Mhm.
possible, and it does now. It's just I don't have to think about going up the stairs and feel like I'm going to collapse at the top of them, and
Wow.
that sums it up.
Cool. Well, in closing here, thank you so much for sharing, some of your story with other people. Is there anything that, someone who's maybe sick and kind of, losing hope or feeling frustrated like you were, anything you want to tell them as they're, that's really who we make this for is because we find people who are sick, that flame of hope it can be very frustrating to be that sick. And you were that sick for a while.
Hmm. Yeah, I mean the biggest thing for me was one, having somebody who was going to continue to push me to find the right treatment plan and something better. And maybe not everybody's blessed to have that, but seriously, continue looking for a doctor who's going to hear you out and is going to listen and understand that even though most doctors do mean well and they're trying their best, they standard standard modern medicine has not caught all the way up to treating in the way that we need to for Lyme disease and the co-infections that come along with it. And if you find yourself watching this video, I'd encourage you to also look into Dr. Warren, and I think you'll be pleased to find that this is someone who can help.
Thank you. That's really our message, is you can be better. And I firmly believe that when I talk to everyone, is, it's a question I get is, do you really think I can get better? And, it's because I get the benefit of talking to people like you, Nick, who like, I've seen it enough times to where, people go, I can't see it, Dr. Warren. I don't know if I can get better. And I go, look, I've seen so many people go from where you went to where you are now that I go, you can be better. And I hope that by, people seeing your story, that's what they think. Okay, if Nick can get better, then, then I can get better too. Thank you so much for sharing with us. And I'll talk with you later. Have a wonderful day, Nick.
Sounds good. All righty. Take care.